So welcome to Candid Canvas once again. Today, without wasting much of time, I want you to introduce a very professional person who's sitting right in front of me. He's a senior most plastic surgeon of Apollo Hospital, which is in Sarita Vihar. So we have Dr. Kuldeep Singh with us today. So welcome Dr. Kuldeep to Luxury Aesthetic and Candid Canvas.
Thank you, Syma. Great being here.
So Dr. Kuldeep has such a vast experience. I want his experience to be shared among you guys. He will be telling us what is in, what is out these days, what is more and what is less, what are the trending treatments and which is best for your skin. So let's start with him. Doctor, just want to ask you about NAD, which is very trendy these days. In India, it has become very trending, and many of the clinics are using it. And since we traced it, we could not find the original NAD here, and it is not FDA approved also. So what do you want to tell our viewers about FDA approved NAD?
So, see, NAD is supposed to repair the damage done to DNA over a period of time with age.
Okay.
And it is supposed to undo a lot of things because it is the DNA damage which leads to changes in our body, aging, face, skin, everything. And is supposed to be the magic bullet. But you cannot reverse everything by just undoing one step. So
Multiple things are required.
yeah, because it is the same like people said about bioidentical hormones. You know, your hormone profile changes with age, and if you reverse that to what when you were 18, then you should. But you will definitely benefit, but you can't go to being 18. So same is with NAD. I think it will take time. There are lot of studies to be done. Then only you will have FDA approval.
Many of the celebrities are using these days, so I also came to know. I am very particular about my looks and all.
Yeah.
So I was there, I think, at that time in London. So I researched about it. So there they had those capsules in the departmental store, which I have got. So they were very expensive, but I don't think so. Okay, they are that good as IV is to us.
See, there is not enough data. Plus, when you consume something orally, the digestive system, including the liver, they break things up and you will not get it in the same form and in the same amount which you can get by intravenous. But again, injecting things which are still not, we definitely do not know the adverse effects. We think that it will go to the right place and undo the right damage and in the right amounts.
Yeah.
So you need, I think we need a lot of more studies, clinical studies.
And we need some professional person
Yeah.
to guide us
Yeah.
about that. Not anyone and everyone
Yeah,
can
because
take it.
nowadays what everybody is looking for
Anti-aging treatments.
anti-aging treatments, and especially if they are non-surgical, non-invasive, then better. But IV has suddenly caught the craze of people.
Yes.
And even that will have a limited effect. I mean, if I infuse something in my body, it will maybe correct some things which are deficient. Which are not deficient, it will not do anything.
So many of the clinics, I will not take the name, but I have seen they are using NAD these days, but it is not at all a genuine product. So
I don't think we have the knowledge yet. I don't think we have.
I have checked the prices of those products. That is why, doctor, that is very cheap products available in the market, which the vendors are giving. So we should not use them on the patients, according to me. What do you say?
I don't know. I think unless something is like we take FDA approval as a standard thing.
Yes.
For a particular indication in a particular way, and injections still are not approved of a lot of the new anti-aging treatments around in the market, and we should be very careful. Like with exosomes now.
Yeah. My next question
yeah.
is the same.
So yes, exosomes are the signaling substances. They can help regenerate certain things.
What are they like? They are injectables?
So they are basically they are not approved for injection yet.
Okay.
They are approved for use with microneedling, with
I have taken it with
frac-
Dermapen, yes.
yeah, with fractional, but not being injected into the skin.
Yes.
In fact, somebody has reported, not there, I think there are many reports now from the US injecting exosomes under the skin. They have reported a lot of complications. So,
It should not be injected.
so not be injected. It can be used topically. It can be used with Dermapen. It can be used with microneedling, and that is what most of the reports are about.
Yeah, the same we do in luxury aesthetic as well. And but it is giving tremendous results to the skin. So
Yeah.
your skin becomes very glowy at once.
Yeah, yeah.
So it's good for the brides even.
So you don't know. See, you are using two modalities together. I would be very happy if one half of the face of the bride you did without the exosomes and one with, and then compared
Yes.
whether it actually made a difference, because microneedling itself will
Give you the glow.
yeah, it will give you a result. So I think with time all this will become very clear. A lot of people are in the process of conducting controlled studies, and you will get definite conclusions from them.
Now comes Sculptra. What is it, and is it in India right now?
No,
I don't
Sculptra is
think so.
not available in India, but there are now. I was in IMCAS Paris a few weeks back, and there are a lot of studies, lot of clinical trials going on with
On this.
with Sculptra and Radius both,
Okay.
to see to quantify how much is needed, how much will produce the optimum outcome, and how frequently it should be used. In fact, a very senior dermatologist there, she has conducted studies, and she said you should not repeat it more often than a year.
Okay.
Not
Once
before
in a year.
once in a year, not before that, because the regenerative effects keep coming for 1 year.
Okay.
And because people were doing it at 3 months, 6 months, and
they
there
want
was no
everything should be
there was
circulated
no
and they-
standardization, and so I think that field is also evolving. People injected, they saw good results, but they could not standardize. Standardize means it becomes standard of care. Everything is in the protocol, and you will get consistent results. So,
So what is Sculptra basically like? I just want to know for the audience.
Sculptra is PLLA, and it is an absorbable product, somewhat like
It is injectable.
the suture materials we use. It is diluted and then injected. It was used for volume earlier,
Okay.
but if you dilute it in very high dilutions, also like calcium hydroxyapatite, and then inject it just subdermal, it is supposed to restore, regenerate,
Cells.
prevent further aging. A lot of things, effects are being now seen. Now, which of these is the more dominant one? Because finally, what you want is control. I inject something, I should be able to control what outcome comes out of
It's
that.
giving, yeah.
I should not say, "Acha, dekhte hain kya aayega." Maybe this will
Not like
improve.
a
Maybe
fluke,
this will
yeah.
improve. Maybe you don't. The predictability is not there yet as to how exactly and what parameters will improve and what is in your control. Can you modify that? So I think in the next few years, all these questions will be answered, because a lot of people are now who are interested in bioregeneration and biostimulation both.
I think mostly the people are these
Yeah,
days.
no, those who are doing pure research, we will have the answers. I think maybe it will be very definite in the next couple of years. So watch this space.
So good knowledge we have got through Dr. Kuldeep Singh. So, doctor, what are the current rate of aesthetic treatments? Like what we were doing before 5 years and now as we are doing it currently?
So, when you get a good treatment, you will see that over a period of time, people try to apply it to every situation. That will help all situations.
Yeah.
You go overboard. Then you realize that no, when you analyze your results, it is the best for this range. So what people started doing was that they started doing treatment for all age groups, all amounts of volume loss, moderate, mild, severe, all amounts of skin laxity. And then now I think we are coming back from overdoing everything to looking normal. There has been
natural look
there
is
has been a
natural
pushback.
makeup,
There has been
yeah.
a pushback, and because of this overdoing, the treatments got a lot of negative publicity. People started saying, "Oh, fillers are not good. Fillers remain. Fillers can do harm," and now again we have gone back, and now the emphasis is to choose the right patients, choose the right treatment, give a natural look, and enhance the natural look. That's it. So I think we are all normalizing. Also, we have realized that if we start earlier, we can minimize the rate of deterioration of tissues with aging. So that is happening now. And earlier people were worried why start early, but you can see a face and predict
Yeah,
how
right.
this person is going to age. I have a picture taken with permission, obviously. One of our senior colleagues, he's like 76, 77, and his granddaughter who's 5. I have their pictures in one frame, and you can see that they have exactly the same problems are happening around the eye.
Okay.
The same hooding of the eyelid, the same grooves, the same nasojugals, the same mid-cheek groove starting, and she's a 5-year-old. So
So
you
such an early age she's
Yes,
starting with that.
yes. So you can tell, seeing faces, how this person is going to age. You
Will
have
be.
chubby cheeks, you don't have a prominent cheekbone, you know that this face is going to go down fast because of the sheer volume and lack of support. So you can do things to help give support so that the descent does not happen. So you can do that. You can do a lot of things now if you start early and you understand the process of aging in each individual. So our understanding is better, and therefore we can plan, prevent, preempt, slow down.
Right.
We can do that, but the future is going to be mostly preventing and slowing down.
So you have to be very, very precise about your treatments before you start with your signs of aging. That's what doctor wants to say right now.
Yeah.
And like in many countries also, apart from India, they are starting the treatments in early 20s even.
Yeah. So if you see Indian faces compared to, say, Caucasian faces or Asian faces, uh, we ethnically have the lower border of our bony socket, the infraorbital rim, recessed as compared to other ethnic
Countries.
groups. And that means there is less support for the lower eyelid, there is less support for the tear trough. So you will see young girls, everybody has a under eye groove. We are predisposed to it. Also, we have a narrower mid face. So there is very poor support. So descent is more.
Yeah.
Wider faces, that descent is not there. You see Asian faces, they've got wide faces. Descent is less. They have mostly volume problems. So we are understanding our faces better.
Aesthetically.
Yeah. Earlier we wouldn't fit. We wouldn't fit into Asian faces. We wouldn't fit into Caucasian faces. We were nowhere, somewhere. People say Asian faces, they meant the Oriental faces. But now we are finding, and in India also, you probably have 4 or 5 types of morphotypes. You have people who are closer to Oriental. You have people who are closer to Caucasian. You have people closer to the typical Indian face, which I just described. Yes. So we are understanding better, and I think this will show.
With time, everything will.
Yeah. But having said that, every person who's treating somebody, they have a signature style. And if you are very careful, you can tell by and large who has treated this person. You know, and nowadays there's another difference between, because of social media, people find the type of doctors who want to and can treat their type of needs.
Okay. Like?
Like if I don't do more volume in lips, I will rarely get somebody who will say I want big lips. They have found out, they have connected, they have asked friends, and people know this, you have to go there if you want this. This fellow is not going to do. Okay, so I think social media is helping in that people are now choosing. So I say I'm doing this. I said no. People are coming to you for doing this because they know that you do like this. So it is a very,
you are trained in that. You are,
yeah, and people find that out, and they will not waste time coming to you when they know that you are not going to do what they need. So in a sense, we are all demand driven,
Yes.
need driven. It is like Pavlov's dogs. Now, this is my favorite joke. So Pavlov's dogs, he conditioned them. Na? So one day the dogs were saying, see, we have conditioned Pavlov. Whenever we ring the bell, he gives us food. So you don't know whether the demand is conditioning the treatments,
yes,
or the treatments are, coming.
Conditioning the
Yeah,
demands.
the demand, yeah.
So it was so lovely talking to you, Dr. Kuldeep. But before ending the show, I would love you to sign this mug, which could stay on our shelves forever with your memories. I just need a small message for me in this for my future. And then a next step we have for you.
No. My God, I've never.
Just your blessings and your good wishes. So today we had Dr. Kuldeep Singh on our panel, which was very, very interesting, very informative, and it was lovely talking to him and having him here for Candid Canvas. Soon we will have another guest, and before signing off, I would love to give him this small, beautiful token from Luxury Aesthetics as usual. So hope he loves it.
Yeah, thank you so
So
much.
we have assorted creams in it for your, though you don't need anything, you are already. So we have some assorted creams in this, which has a scrub, moisturizer, and all the stuff like 4-5 kinds of moisturizers in it. Hope you love it, and see you
I
very,
will.
very soon.
Thank you so much. Thank you. It was a pleasure talking to you. Yeah,
Same
thank
here.
you.